When should my child be seen for an orthodontic consultation?
I'd probably say 6.5 to 7.5 years old is a reasonable age, and that's when the first adult teeth come through. So the teeth that we'd be looking at are the 2 lower central incisors and the back first adult molars. And really at that stage, what the orthodontist is looking for, it's not just about correcting bite, it's making sure the teeth that are there are healthy, the general dental development is normal, and also that's where the bite comes in.
What is the consultation procedure for orthodontics?
So the orthodontist will often start by asking you what your concerns are and also your child's concerns. And that can range from really simple things like concerns about the bite to concerns about the child's appearance and how that affects the child on a day-to-day basis. The consultation will then move on into the orthodontist taking a look inside your child's mouth. And at this stage, what we're looking for is to make sure that the teeth that are in the mouth are the teeth you'd expect to see at the child's age. There's also a general dental examination to make sure everything is healthy in terms of the soft tissues. To take it a step further, the orthodontist might then decide to take x-rays on the child if needed to make sure that the dental development is normal. And often there's 2 types of x-rays that orthodontists would take. The first is called a dental panoramic x-ray, which gives us a general overview of the overall development of the teeth. Generally, the earliest you'd consider to take this type of x-ray is around 7.5 to 8.5 years old. That's only if you have concerns about the dental development. And really, what we're looking for is to make sure the teeth are in the correct position, we have the correct number of teeth, and the development is normal. After the x-ray, there's a general overview to look at the bite, and then the orthodontist makes an assessment whether we need any interceptive treatment. And by that, I mean any early treatment while the child still has a mixture of adult teeth and also baby teeth. And that could include simple things like a recommendation going to see the hygienist for a dental clean, maybe having some treatment with a dentist, or taking it a step further into more involved orthodontic treatment to maybe look at correcting the bite, say if we need expansion, which is much easier to correct early on when the children are young and the bone is still growing, or maybe correcting small irregularities in the bite to protect the teeth. For example, if there's an anterior crossbite and there's risk of wear to the anterior teeth in the child's mouth.
When would orthodontic treatment usually start?
Again, the orthodontist would make a tailored plan according to the needs of your child. But to answer the question more specifically, orthodontic treatment can start as early as when the first adult teeth come through, which is really 6.5 years old. Treatment can be really simple treatment from correcting abnormalities in the bite while there's still a mixture of adult teeth and baby teeth, and this can often run anytime between 6.5 to 11 years old when there's a mixture of teeth. And really what we're trying to do over here is to try and come in early and introduce treatments that will help simplify problems later on that can be more complicated to treat.
Can my child have Invisalign?
The answer is yes. Over the past few years, there has been remarkable advancements in terms of research and development in the Invisalign appliance. And one of the newest innovations in the Invisalign appliance is the Invisalign Teen, which is actually the Invisalign brace tailored to treat children whilst they have a mixture of adult and baby teeth, and also help correct the positions of the lower jaw. So the answer is absolutely yes.
How long does orthodontic treatment usually take?
Well, if the orthodontist is carrying out treatment when your child has a mixture of adult teeth and baby teeth, that's called interceptive treatment, you're looking at approximately around 6 months to a year. If the orthodontist is carrying out treatment with conventional braces or perhaps maybe with an Invisalign Teen brace, depending on the complexity of the case, that can range from a year to 24 months. In most situations, it's quite a reasonable question to ask your orthodontist, how long will my child's treatment take? And I'd probably say that most orthodontists will be able to give you a pretty good estimation.
How often will we need to visit the practice?
So during orthodontic treatment, often your orthodontist will ask you to attend for regular visits every 4 to 6 weeks. Now, during these appointments, the orthodontist will make a close inspection of your braces, your teeth, and your gums. They want to make sure that you're looking after your teeth and your gums well, and the treatment is progressing in the right direction. The orthodontist will also make adjustments to your brace to make sure the braces align your teeth as you continue through your treatment care pathway. Now, a question that I'm often asked by parents and also patients is, how often, or do I still need to go see the dentist or the hygienist during orthodontic treatment? And the answer is an absolute yes. You must continue to see the dentist and the hygienist whilst you're undergoing orthodontic treatment. In most cases, orthodontic treatment is very safe with no major impacts to your teeth. However, at times, if there are issues with the brushing, then the teeth may be more prone to decalcification and the gums may be more prone to being swollen or uncomfortable. So it's very important that we support you and your child during your treatment. So within the practice, we've created a bespoke program where you can see the hygienist and they can provide you advice and support.